Today we're here with Jalene Carpenter, President and CEO of the Nebraska Healthcare Association. Thanks for spending time with us.
Absolutely, it's my pleasure to be here.
So what are the primary issues that your members are facing in Nebraska right now?
So, like many parts of the country, we are facing workforce. What's a little more challenging is Nebraska is a very rural state, and so workforce leads to access. We've seen many providers limit admissions for such a long period of time that it's actually resulted in closures. So workforce, we talk about workforce, but really workforce transitions to access for us in Nebraska.
Such a critical issue. Why did you decide to attend this year's congressional briefing?
You know, for many reasons, but we're really proud in Nebraska to have brought with us direct care providers. And so we have CNAs, medication aides, activity directors. And so for me to attend, it's the way for them to tell their story. And you know, I also just believe that these are the things that can make a difference. Being in DC and telling somebody a really personal story might feel anecdotal and not important, but it is what impacts change in the long run.
Absolutely, those stories will really stick with them. In what ways is the Nebraska Healthcare Association engaging in grassroots advocacy back home, and what results have you seen?
So we've been trying to do some creative things, and so this year we had a very successful Facebook Live town hall with really trying to engage members across the state to get the message out not only to their local official but also to the general public. And so it actually was incredibly successful and very impactful because we had these group of people talking about their struggles, but at the end of it we talked about our why. We talked about why I work in long-term care, and that's such an important story to tell.
Absolutely. I love how you're using the digital to sort of conquer the distance.
You know, we still do those traditional things. We're very grateful. We're getting back into buildings, doing tours with senators, and that is important too, but we're also trying to figure out better ways to communicate with not only elected officials, but also the general public. We really feel like with all of our issues, now is the time to engage the population as well, because people are understanding, especially in our state, when we've had facilities close, access is going to be really important, and we need to leverage that kind of sense of urgency.
We know there are several key challenges facing the sector, and we're trying to address those here at Congressional Briefing, but what, in your words, makes you optimistic about the future of the sector?
I am incredibly optimistic. Because of the simple fact we as an industry have discussed and begged for change. We have the opportunity right now to actually impact change and to make it happen. It's scary, but I am incredibly hopeful that we as an industry are going to take this moment and we're going to leverage it.
Such a pivotal moment, hopefully.
Yes, it's so exciting.
Well, thank you for spending some time with us. We appreciate it.
Absolutely. Thanks.